Hello, welcome to our webinar titled Integrative Medicine. Thank you for joining us today. My name is Lee Clark, Director of Patient Services, and I'll be moderating the presentation today. As we get started, I'd like to recognize the generous support of our corporate sponsors and also the generous support of our patients, families, and caregivers for supporting the webinar today. Before we get started, I'd like to let you know about an opportunity to meet others for support and to share experiences with your journey with bone marrow failure. Each month, AAMDSIF hosts virtual support groups. These are groups which are led by patients and caregivers such as yourself. All of our groups are posted on our website, which is aamds.org. Each of the groups has its own registration. So once you select the group that you'd like to attend, go ahead and register. And once you register, you will receive an email confirmation. Part of that confirmation will have the log information for you to be able to join that group. So we hope that you'll find those groups most helpful in meeting and connecting with others. Now let's get started about our webinar today. Immediately following the presentation, there will be a question and answer session. If you'd like to submit a question or a comment, just use the Q&A icon in the engagement panel to your right. Submit your question or comment using the text box window. When you finish typing, just hit enter, and we'll do our best to get to everyone's questions today. When asking your questions, I do ask that you do two things to help me manage all of the incoming questions. First, submit your entire question all at the same time. Second, please do not share private health information in your question. Our speaker today cannot answer any specific questions related to your healthcare or recommend specific treatments for you or your loved one. Our expert today is Dr. Nathan Handley. He is the director of the Integrative Cancer Recovery Program at the Marcus Institute of Integrative Health, Jefferson Health, an assistant professor in the Department of Integrative Medicine and Nutritional Sciences. He is board certified in internal medicine, medical oncology. Whoops, my screen, of course, just switched here. Oh, here we go. Whoops. I'm sorry, I'm going to start over. He is board certified in internal medicine, medical oncology, and integrative medicine. He has expertise in providing comprehensive, innovative assessments and treatment approaches for cancer survivors and others looking to optimize wellness and enhance the healing process. It's my pleasure today to welcome Dr. Handley.
You. All right, I'll share my screen here. All right. So welcome, everyone. Thanks for joining us this afternoon over the lunch hour, at least if you're on the East Coast, the lunch hour. Today, I'm going to talk to you about integrative medicine. What is it and how we think about it? So integrative medicine is also sometimes called integrative health or integrative healthcare. It used to be called complementary and alternative medicine, but it's an approach that basically combines evidence-based medicine, leading-edge technologies, emerging innovative therapies, and other complementary approaches to address improving your overall health and well-being. The goal is really to address not only the physical components of health, but also mental, social, and spiritual aspects of health in a holistic manner. It's important to note that integrative medicine does not reject conventional medical practices. Rather, it seeks to enhance the effectiveness of medical care, the care you're already receiving, by incorporating a broader range of therapeutic options. Integrative medicine recognizes that each individual is unique and may benefit from a combination of approaches tailored to their specific needs and preferences. The idea is really to offer compassionate, personalized care for anyone who has been affected by chronic illness, whether they are newly diagnosed, whether they're in active treatment, or they've kind of completed an initial phase of treatment. So some of the challenges that develop over the course of treatment for a chronic illness, whether bone marrow failure condition or a malignancy, include things like brain fog, numbness in the hands and feet, changes in appetite, changes in weight, chronic fatigue, certainly a big one, decreased endurance, digestive complaints, decreased immunity, sleep changes, environmental sensitivities, all these things can develop. And in addition to these physical symptoms, patients might also experience social, emotional, spiritual, and existential challenges. So our goal is to treat each person as a whole person, not just as a diagnosis. We understand in integrative medicine that a patient's biology, psychology, lifestyle, environment, social situation, and meaning and purpose in life are all really crucial components of healing. And integrative medicine is done in conjunction with your primary treatment team over the course of the journey. So we can think of integrative medicine as having these 5 buckets that we show here on the screen: patient-centered care, holistic, evidence-based, focused on prevention and wellness, and collaborative. And so we'll talk about each of these in turn. By patient-centered, we mean that integrative medicine really places the patient at the center of their healthcare journey. It emphasizes understanding and addressing the individual's unique physical, emotional, mental, spiritual needs and preferences. And this principle really involves active listening, respect for values and beliefs, and collaborative decision-making. The holistic approach notes that health and well-being are influenced by many factors, including lifestyle, environment, genetics, social interactions. And so the goal is to treat the person as a whole person rather than just an isolated symptom or disease. It takes into account the interconnectedness of various aspects of health. It uses an evidence-based combination of therapies, and so it incorporates evidence-based practices from both conventional medicine and complementary therapies from other healing traditions. And some of those things include acupuncture, massage, yoga, nutritional counseling, mind-body practices. And we'll get into some of those today. There's a focus on prevention and wellness. So there's a big emphasis on promoting overall health. And so this includes education about healthy lifestyle choices, stress management, nutrition, exercise, that type of thing. And then it is collaborative and is kind of focused on teamwork. And so it encourages collaboration among healthcare providers from different disciplines. The goal, the hope generally is that there's some humility in the approach, that rarely one person have all the answers. And so this interdisciplinary approach allows practitioners to pool their expertise and work together to develop a cohesive and personalized treatment plan. So why does this matter for bone marrow failure? I think it's particularly important for patients with these conditions, because this kind of multifactorial way of thinking about the whole person, I think it can be a kind of a unique lens on what can be a challenging condition. So we're going to talk through each of those 5 concepts in more detail, starting with the concept of patient-centered care. And so when I say patient-centered, again, what I mean is that the patient is really at the center of the healthcare journey. And so this approach emphasizes understanding and addressing the individual's unique physical, emotional, mental, and spiritual needs and preferences. The principle involves active listening, respect for values and beliefs, and collaborative decision-making. So the concept of whole health is a framework that has started to come up in different areas. And I like it as a framework. I think it fits very well into the integrative medicine framework. It's really a framework for proactively engaging in health and well-being, and for recognizing that health is more than surgery or chemotherapy or something like that. This figure is from an integrative medicine textbook that we often use, and I find it helpful in illustrating this point. So in this picture, The individual is at the center. And this kind of emphasizes that you are the most important person for your own health. And then moving out from the center, we see what a person can do for self-care and what influences your health directly. So these things include your thoughts and your patterns, who and what you surround yourself with, and how you nourish your mind and your body. The next circle includes so this is like the lighter blue, like the darker blue circle, the next to the outer ring. That includes members of your care team, professionals who can help you. And then the outermost circle includes community and acknowledges that while self-care is important and really fundamental, no one has to seek care alone. So this framework helps us understand that everyone's unique, everyone's circle may be a little bit different, but there are important commonalities in a basic formula, which is at the bottom here, you plus self-care plus professional care plus community is whole health. And so there's a chapter in this textbook that proposes 3 questions to start meaningfully engaging with different parts of a person. And these are the 3 questions. One question is what? So what gives your life meaning? What's important to you? What do you live for? Why are health and living well important for this? Where? Where do you need to start to improve your quality of life? Is it diet? Is it exercise? Is it sleep? These are all connected. Sometimes people come in and their biggest kind of complaint is one of these things. But none of these things live in isolation. And as practitioners, we don't have to take the paternalistic approach of figuring it out for the patient. We can help the patient sort out first steps. And then who? Who do you need to support you on your journey? No one is an island. We're all connected, and we need those connections. So who is important to you? So I like the concept of these 3 questions, in large part because they are really about an invitation to a conversation. They are kind of reminiscent of something called narrative medicine, which was, I would say, most prominently introduced into the medical world in an article in JAMA in 2001 by a practitioner, Rita Sharon. The concept in narrative medicine is that people with illness need physicians who can understand their diseases, treat their medical problems, and accompany them through their illnesses. Despite all of our technological progress in diagnosing and treating illnesses, physicians sometimes lack the capacity to recognize how someone feels, the plight of their patients, and sometimes lack the ability to extend empathy toward those who suffer and to join with patients in their illnesses. Scientific medicine alone can't really do that. Can't help someone grapple with the loss of health or to find meaning in suffering. And so along with the typical scientific ability that physicians are trained with, we need the ability to listen to the narratives, to the stories of patients, to understand what makes them how they are, what makes this particular condition particularly trying for them, to grasp and honor their meanings, and to be moved to act on the patient's behalf. And so this is really what allows medicine to be practiced with empathy and trustworthiness. So let's see. There we go. So moving on to the next category, which is holistic. So integrative medicine recognizes that health and well-being are influenced by many factors, including lifestyle, environment, genetics, and social interactions. And as we've now discussed, it aims to treat the whole person rather than just isolated symptoms or diseases, taking into account the interconnectedness of various aspects of health. So we sometimes think of this as a multi-omic approach. And so what is multi-omics, or what are omics in general? This is an approach that focuses on identifying and addressing kind of root causes of diseases by looking at different systems of the body. Each symptom or differential diagnosis can be caused by many different contributing factors. And oftentimes a diagnosis can be the result of more than one cause. And so as an example, depression we think of as a diagnosis. But depression is really many diagnoses because it can arise from many different conditions. It can be caused by lots of different factors, like inflammation, for example, or kind of major life changes, which have certain effects on the bodies. The precise manifestation of each cause that our bodies kind of interact with in the world depends on the individual. It depends on the individual's genes, depends on their environment, depends on their lifestyle. And only treatments that address the right causes will have lasting benefit beyond just kind of suppressing symptoms. And so this figure here is an example of the functional nutrition, something called the functional nutrition matrix, which takes into account many variables in order to create kind of a complex picture of the whole. And that includes things like mind, spirit, emotions, community, structural integrity of different pieces of the body, the gastrointestinal tract, environmental influences, immune influences, detoxification mechanisms, any triggers that may have happened. And so in addition to these, we can incorporate this multi-omic approach. And so the omes that we sometimes think about are things like the genome, the genes in our body, the microbiome, which is kind of the health of our gut, which we'll talk about more, the metabolome, which is kind of the metabolic functioning of the body, the exposome, which includes things that we are exposed to in our daily lives. So that can be toxins, but it can be kind of anything that happens outside of our body. And then the sociome, which is how we interact with other people at kind of a social level. So we'll talk about some of these specifically and give some examples of how we can actually test them sometimes. And so we'll talk a little bit about the microbiome here. So the importance of food and more broadly gut health has been something that has been appreciated for millennia, really. Hippocrates is credited for saying all disease begins in the gut. This is not to say, though, that the development of disease is really driven by what we eat, though that can play an important role. I think what's interesting and what we're beginning to find is that the health of the gut is actually affected by many factors. And these factors can take center stage during the treatment of and recovery from chronic illness. So what does this look like? And how is gut health affected during a health journey? I think one way to think of how the microbiome and the gut health in general affects the body is through the example of cancer development. I think this example in many ways serves as a model for how other chronic and complex conditions can also be affected by the microbiome. But cancer development or carcinogenesis is this complex multi-state process. It's influenced by your immune status, but also environmental risk factors. And interestingly, we're beginning to find increasingly that the gut microbiome, which is all the bacteria and things that live within our GI tract, and its products are of major importance. So we know, for example, that specific microbial pathogens drive cancer development in up to 20% of cancer cases. Some more obviously than others. So we think about Helicobacter pylori for gastric cancers, or certain viruses like HPV or Kaposi's sarcoma, Kaposi's, some of those different viruses. Interestingly, an even larger number of malignancies are associated with dysbiosis, which is kind of an imbalance of the gut microbiome. And this is based on microbiome studies utilizing these sophisticated sequencing techniques that show a strong association between dysbiosis and cancer development. And so while these association studies can't distinguish whether changes are causes or effects of cancer, a causative role is increasingly supported by studies that are beginning to emerge. These studies show that the microbiome can alter cancer susceptibility and progression by many mechanisms. And these are some of the mechanisms shown on this slide, like modulating inflammation, causing DNA damage, increasing gut permeability, producing metabolites involved in cancer development. I think the even trickier part is that once they've developed, cancer cells secrete metabolites that affect the gut bacterial diversity and composition, which can then lead to immune inhibition. And as we've learned with the growth of immuno-oncology, one of the major mechanisms by which cancer cells grow specifically is by avoiding immune surveillance. But there's a flip side to this potential negative interaction of the microbiome. Because while the microbiome can have a cancer-causing effect, it can also have a tumor suppressive effect. So byproducts of the microbiome, which we call postbiotics, have the capacity to serve as antioxidants. Some, like short-chain fatty acids, can enhance barrier function of the gut. And in the setting of kind of the interaction between the bacteria and the gut, these bacteria can produce compounds and support the production of cytokines and other factors that can affect the entire body and can drive anti-inflammatory pathways. And so this is an example kind of specifically for cancer, but I think it is, we are increasingly finding that this equation is true for many complex chronic diseases. And so the question is, how do we flip this coin? And one of the approaches that we use is listed here, but the short answer is that there's a lot we can do to kind of think about how we rebalance the microbiome. The most important point may be that nourishing the microbiome and flipping that coin from the previous slide, this, the top, flipping from the top to the bottom, involves repairing the entire GI tract. And it requires this broad integrative approach. The approach that I generally talk about with my patients is the 5R framework, which is shown here. This, I believe, was initially developed by the Institute for Functional Medicine. And I like it because it provides a structured, stepwise, comprehensive approach to thinking about the different components of GI integrity and function. So maybe you've heard about this before, maybe you haven't. I won't spend a huge amount of time, but just to talk about each of the 5 pieces a little bit, there are 5 parts. You can kind of start at any of these points, but we usually start with remove. Remove is removing things that can be causing direct damage to the GI tract. And so, there are some examples of this that are easy. Certain, if someone has like an overt allergy to a certain food, that's an easy thing to remove. But there's certain dietary choices that can be better than others. Some foods tend to have more of a kind of inflammatory quality than others. And so with the remove piece, we often think about dietary guidance. The next step is replace. And so this is about replacing components that may be missing in processing what you take in. And so oftentimes, if dysbiosis develops in the gut functions less efficiently and may produce less stomach acid, for example, or fewer digestive enzymes from the pancreas. And so patients may need extra enzymes to help with their processing. The third is reinoculation. And this is where probiotics come in. Probiotics are not a required part of this, and we sometimes worry about it, especially in people who have really low neutrophil counts, for example, or white blood cell counts more broadly. But this is the idea of trying to adjust the balance of what bacteria are present in the gut, moving from ones that tend to cause harm to ones that tend to heal. The fourth is repair. And so this is focusing specifically on the intestinal lining, the kind of the integrity of that barrier between the inside world, kind of the inside of our bodies, and the outside world, which is kind of what is contained within the gut or the GI tract. And then the fifth here is rebalance. And rebalance is kind of a catch-all, but it also includes thinking about how the rest of the body and how the rest of the body impacts GI health. And so we often think here about the nervous system, because the nervous system and the gut are really deeply interconnected. And so you may have heard of the concept of the gut-brain connection. If the gut is not operating well, the brain may not operate as well. So you can get brain fog and things like that. But the opposite is true too. If the brain is not functioning well, that can affect the gut. And much of this happens through the balance of the nervous system, which has a sympathetic, which is the fight or flight piece, and the parasympathetic, which is the kind of rest and digest part of the nervous system. And so thinking about kind of the balance of the nervous system, whether it's more for most people and in our country and then modern world, most people are kind of in like sympathetic overdrive much of the time. Adjusting that balance can then have the trickle-down effect of enhancing the health of the gut, which I think probably makes some intuitive sense to people. Like if someone's really nervous all the time, maybe they feel that they get like a queasy stomach, maybe they get like some looser stools. Like that's a very visible and clear example of the connection. So, sometimes we specifically test the function of the gut microbiome. One of the tests we use looks for the need for digestive enzyme support, the need for kind of change in the inflammatory balance. It looks at the balance of the bacteria that are present, whether there are too many, too few, the need for kind of more support for the bacteria that are present as well. And so bacteria feed on kind of particular types of food, which usually are derived from whole food products, like not the store whole foods, but like minimally processed foods like fruits and vegetables and whole grains. And then we also can look for kind of specific pathogens. And so one we often think about is C. diff, but there's a whole host of other bacterial pathogens that can be present. And so, one thing that can be done is you can test for this in a really structured way. And just an example of one of the other ohms that we sometimes test is the metabolome. And so this is basically the sum of the reactions, the chemical reactions and biochemical pathways that are happening in your body. And so this can be kind of broken down into a couple of categories, such as oxidative stress. So oxidative stress, when we think about antioxidants, we're thinking about oxidative stress. And this is basically like the process of, you can kind of think of it as like rusting in the body. And so sometimes everyone needs a little bit of oxidative stress. That's normal to have. It's a normal part of how the body functions, but it tends to kind of be tipped in one direction. And so, that's something that we can look at. We can look at mitochondrial support. And so mitochondria are really kind of it's like the foundation of energy production for the body. And certain molecules are strongly associated with mitochondrial function. So we can support that specifically. We can look at the balance of inflammation in the body. We can look at how well detoxification is happening in the body by looking at kind of specific toxins that may have been retained in the body, and by looking at kind of some of the efficiency of pathways that are involved in detoxification. And then we can also look at methylation. And so methylation, that's a term that is maybe a little bit less familiar. That is kind of the process that allows cells to function smoothly. It basically can turn genes on and off. It's kind of what allows the wheels to kind of keep running smoothly. It's maybe kind of like what greases the wheel, if you will. So there might be questions about some of those things, and happy to answer them if they do arise. But I want to move to some of these next categories. And so one one of the things we talked about was integrative medicine as being evidence-based. And so what that means is that it integrates evidence-based practices from both conventional medicine and complementary principles. And this principle acknowledges the value of a wide range of approaches, including things like acupuncture, massage, yoga, nutritional counseling, and mind-body practices. And I think it's worth talking about a few specific examples where we think about useful tools that have a lot of evidence to support their use. And so I'll focus specifically on acupuncture and mindfulness. So starting with acupuncture, acupuncture I think is really fascinating. And it's not something that I had a lot of personal exposure to until I until I did my integrative medicine fellowship, actually. And then I was really kind of blown away by its complexity and sophistication. It is this ancient evidence-based form of medical therapy rooted in Chinese medicine that's been described in medical tests dating back about 3,000 years. The practice was probably developed well before then, actually. Some suggest that it may have been over 5,000 years ago, which I can talk more about that if anyone is interested. But basically, how acupuncture works from the perspective of Chinese medicine is that it manipulates energy in the body, and energy is called qi within the system. And so in the system, energy or qi travels through channels, or sometimes called meridians. And by inserting very fine needles onto carefully selected points on the channels, the energy is rebalanced. Blockages are removed. And so one practitioner describes this as reducing what is excessive, increasing what is deficient, circulating what is stagnant, and stabilizing what is reckless. From a biomedical standpoint, the mechanism is not entirely clear, though several intriguing theories have been proposed. And again, I'm happy to discuss that more if anyone's interested. But from a evidence-based standpoint, since the 70s, there have been over 10,000 randomized controlled trials on acupuncture, and it's increasingly accepted as an effective modality worldwide. The World Health Organization notes its utility in treating dozens of conditions. And actually in 2022, a group of researchers completed analysis of more than 2,400 systematic reviews of acupuncture that suggested it is underused as a treatment modality in both clinical practice and health policy, and I would agree with that. It's an intervention, a therapy that I recommend for most of my patients, really. It's hard to think of someone who wouldn't benefit from it. And so specifically in the context, I'll give the example of cancer again, because that's kind of a broad bucket. Evidence for the use of acupuncture continues to increase. There was a meta-analysis of 10 randomized controlled trials published in 2017 that found a significant reduction in fatigue. There was another study that showed reduction in pain. It can decrease fatigue, depression, neuropathy. The National Comprehensive Cancer Network includes acupuncture as a modality considered in a variety of components of survivorship care, with a particular emphasis on fatigue, hot flashes for men and women both, neuropathic pain, arthralgias or joint pain, myalgias or muscle pain, myofascial pain, nausea, and vomiting. And interestingly, in December of last year, the American Society of Clinical Oncology and the Society for Integrative Oncology released joint guidelines regarding integrative medicine for pain management in oncology. And they noted that acupuncture should be recommended for aromatase inhibitor joint pain as kind of a first line type of treatment for that condition. And so while that may not be specific for you, I think it's representative of kind of the breadth and depth of what it can be helpful for. In 2016, a study found that nearly 3/4 of NCI-designated cancer centers offer acupuncture, and nearly 90% provided information about it. So something to consider. Another category is mindfulness. And so mindfulness has been defined as paying attention on purpose in the present moment, non-judgmentally. And the idea is really to do just one thing and focus on that thing with the ultimate goal of gaining more control of your mind so that you can respond to life rather than react to life. There are a number of formal mindfulness programs that have been developed. The best study of these, really the gold standard, is something called MBSR, or a mindfulness-based stress reduction, which is an 8-week program offered at many organizations. But it can be a very powerful tool. And complex chronic illness can be one of the most stressful experiences in your life. Not only is the treatment itself a major challenge, but additional stress can come from concerns about work, family, finances, and then that can all make things more difficult. And so we have a number of guided practices that are available on our website if anyone is interested. You can look up the Marcus Institute. And then within MBSR, we have practices like the body scan, sitting meditation, expanding awareness, loving kindness. Some of you may be familiar with these practices from other apps. And if you're not, then I would encourage you to begin to explore them. Okay, now let's talk about prevention and wellness. So integrative medicine puts a really strong emphasis on preventative measures and promoting overall wellness. And a lot of this, and so I'll talk here about diet, activity, sleep. And then I'll throw in another one of the omics pieces that we didn't talk about in one of the prior sections. So diet. I don't want to focus too much on diet here because I think diet's very important. I feel like if people are not careful, it can be easy to become overly focused on diet. And so, but it's true that a healthy body needs a healthy diet to function at its best. A good diet can help maintain your immune system, can prevent body tissues from breaking down, can enhance your ability to manage side effects from treatment. In an effort to keep it simple, I think a few principles are worth considering. One is eating enough. It's easy to not eat enough, especially if you're not feeling well in general. And so sometimes smaller, more frequent meals may be helpful. Eating food. So that's what I mean by this is that there's this quote from a book by Michael Pollan. The book is In Defense of Food, in which he says, eat food, not too much, mostly plants. And what this means is eat real food, things that are natural, not things that are highly processed. Eat enough, but don't overdo it. And try to eat a lot of fruits and vegetables, basically. And then stay hydrated. I think it can be easy to become dehydrated when you're being treated for a chronic condition. And so 8 to 10 8-ounce glasses of water per day is reasonable for many people, but you don't have to be overly focused on it necessarily. So I'm just going to leave it at that with diet. And then activity is another topic that often comes up. And we know that exercise is good for our bodies. Sometimes it's harder to exercise when you have a chronic illness, but what research has continually shown is that for most people, exercise is safe and helpful before and during treatment. So the American Cancer Society and the American College of Sports Medicine basically say the same thing about exercise, which is the goal of having 150 minutes per week. And this is not like something that's written in stone, but exercising several times a week for at least 10 minutes at a time can be very, very helpful. And the goal is not to overdo it. I think especially if you have a bone marrow failure condition, it's probably pretty easy to overdo it with this kind of thing. But gentle exercise counts. And so this may be stretching. I think some of the gentler approaches like yoga or Tai Chi or Qigong can be very beneficial for people. Sleep is something that often comes up as well. Here it says cancer. I think this is true for kind of any chronic condition. Sometimes the major treatment is managing side effects of treatment. But the other thing that we often talk about is sleep hygiene. And so that's getting yourself in the best spot to be able to sleep well. And that includes things like keeping your room quiet, dimming or turning off lights, keeping the room at a comfortable temperature, avoiding watching TV in the bedroom, staying active during the day, going to sleep and waking up at the same hour every day. Other approaches can be helpful. Acupuncture, which we talked about before, can be helpful for this. Cognitive behavioral therapy can reduce anxiety and help relax. There's specific cognitive behavioral therapy for insomnia that can be very helpful. And actually, the VA hospital system, the Veterans Hospital System, has an app that is freely available called CBTI, which focuses on that technique. Medications can sometimes be helpful too. We try to use them sparingly because they can sometimes be habit forming, but the goal here is to reduce suffering. And so we use whatever we can to do that. One emerging tool that I wanted to talk about briefly here is genetic testing. And so this is looking at genomics. And this is something that will be familiar to people with AML or CLL or MDS, but this is a bit of a different take on genetic testing. And this approach is designed to provide clear insights and recommendations about areas of health that may be important to you. And it selects genes that are different from the genes that are typically tested for bone marrow failure syndromes. These are genes that are really actionable. They're selected for testing because there's a documented action you can take to reduce your risk of a certain condition and to improve your health. And the recommendations for how you affect how the gene functions in your body are based on dietary changes, lifestyle modifications, or targeted supplementation. And so kind of the 5 main categories that we think about when we think about genomic testing are nutrient needs. So we can kind of assess what your body's unique needs may be based on your genomics, the blueprint of how your body is put together. How you respond to certain foods, how you tolerate fats and carbs, how much vitamin D you might need, if you require extra antioxidants, for example. Can kind of assess your fitness strengths, how you best might exercise, what type of exercise you may best respond to, how you can train smarter in alignment with your genes for better performance, faster recovery, fewer injuries. We think about proactive prevention to understand if your body's more prone to high blood pressure or high blood sugar, high cholesterol. We look at processes like inflammation, detoxification, methylation. We can think about your weight, how well your body resists weight loss, and how you can manage your weight in a healthy way. And stress. We can kind of look at how life stress affects your brain health, your hormones, your sleep quality, and your overall wellness. And in this last 2 minutes or so, the final category is collaborative. And so integrative medicine encourages collaboration amongst healthcare professionals from different disciplines. And this really allows practitioners to pool their expertise and work together to develop a cohesive and personalized treatment plan. And this can be hard, especially with kind of complex chronic condition. I think, and this is probably something that someone with bone marrow failure syndromes suffer from often is complexity of care. Lots of different people involved in healthcare, and knowing how all the pieces fit together can be very difficult. And so we try to think about how effective communication and coordination amongst the team can be achieved. So it's collaborative in that way. I think the other way we think about collaborative is through connection. And so, fear, anger, sadness, loneliness, uncertainty. These are all common experiences for patients with difficult conditions. Connecting with family and friends can be very helpful. And family and friends often want to be very helpful. They may not have specific experiences that connect with your condition. And so it can sometimes be helpful to consider a support group, a place to connect with other people coping with a chronic illness. These can be in person, they can be virtual. Some organizations also offer something called a buddy program, which can match you with people who have the same type of condition as you. But then also connecting with your community can be helpful, and can remind you that life is about more than your diagnosis. And your community might be friends, an organization you're part of, a book club, a faith-based organization. These can all be helpful ways to connect. So if you feel like some of these things might be helpful to you, you can talk to your friends and family, maybe talk to your care team about it. There are a lot of resources available. So we try to pull a lot of these things together in our program. Here's kind of a list of some of the things that we do. We don't need to focus on this slide because I want to make sure we have time for questions and answers. So I'll stop there and see what questions may have come up.
Great. Thank you so much for the wonderful presentations. And we do have some questions. Our first question comes from a patient with aplastic anemia. They've been treated with cyclosporine. However, it does come with renal failure side effects. They'd like to know, is there any type of integrative or alternative therapy to consider outside of just using the standard cyclosporine that you may be aware of?
Yeah, I think that's a good question. And I'm sorry to hear that this has been sounds like a struggle. So, one thing that we're careful about in the world of integrative medicine is not necessarily using complementary therapies in place of conventional therapies. We like to use them to enhance conventional therapies and to increase the tolerability of conventional therapies. And so if cyclosporin is difficult to tolerate, there's probably an alternative conventional therapy. And there are ways to enhance the ability to tolerate cyclosporin. And so some of the approaches would be acupuncture, for example, as one approach that might help manage some of the side effects. Has it been studied specifically in that condition? Specifically for that purpose? No, but well, maybe. But it is kind of a very powerful rebalancing tool in general. And then I think looking more specifically at how your body operates, how your body processes different things. You may need additional detoxification support based on your genetic makeup, for example. That might help us understand how better to help you tolerate the treatment that you're getting. And so rather than thinking of like, maybe we can find a different treatment, maybe we can think of the other approach would be, how do we think about making this treatment work better for you? Yeah.
Thank you so much for that. Our next question is also from an aplastic anemia patient saying, I've heard that sometimes taking supplements, over-the-counter supplements, can skew blood counts. How do you know what supplements that you would take would do that? Or is that even true?
I think that's a fair question too. And when you get into the world of complementary therapies, things can get pretty murky pretty quickly. So if you go into like a health food store, there are aisles and aisles of supplements that are proclaiming their ability to, enhance your immune function or do this or do that. I think it just has to be done cautiously and ideally with the support of someone who is well versed in how those supplements operate. Because anything that we use to affect how our body operates will do that. Will do just that. It will have an ability. It will affect how our body operates. And supplements, while we think of them as benign, if they can cause benefit, there's also the possibility that they can cause harm. And so it's hard to say specifically like this supplement, not so good, this supplement, not so good. It really depends on the individual. Depends on the medications they're taking. And it depends on what they're trying to change. And so what I would say is the best approach is to be open with your care team about what challenge you're trying to address. And ideally, they will be, well, they may not know specifics about the supplement. They can kind of help think through the process with you, or maybe recommend a practitioner who can help with that. I think what's really interesting about kind of supplements in general is there have been a number of studies, certainly in the cancer literature, that suggest that patients are really often reluctant to talk to their care team about supplements because they don't think it's relevant, or they worry that the care team doesn't want to hear about them. And I think that's understandable, but I think the best practice is really to be open, because you may be very surprised by how supportive they can be.
Thank you very much. Our next question is, what's the difference between holistic and integrative medicine?
Yeah, I would say they're the same. And so, integrative medicine has gone through many iterations over its life. And so it was initially called, alternative medicine. And we don't really like that anymore because we don't consider it to be alternative. We don't think we should be doing this or that. We like the idea of like doing both. And then it was called complementary and alternative medicine because we like the idea of complementary, but not so much alternative. Not so much into that. And so if you look at the NIH centers that have supported integrative research, its name has changed over time to reflect this change. And so now it's called the National Center for Complementary and Integrative Health. And they use a lot of terms like whole person health or holistic care. And so I would say integrative, holistic mean the same thing. Other words that sometimes come up are precision medicine, which is, I would say, falls into the same category. And then functional medicine, I would call, that's like a category within integrative medicine, which I can talk more about, but that's a whole nother topic. So if there's a specific question, I'll go into it more, but for now, I'll just leave it at that.
Thank you very much for that. Our next question is, how would I find an integrative professional to work with my team?
So that's a good question. So integrative medicine is now a specialty of internal medicine. And so there's a board certification process by which people can, be board certified to practice it. And so you can, one of the ways would just be kind of looking, kind of searching your area for integrative health practitioners and then looking at their credentials. And seeing what their training is, seeing if they have done a fellowship, for example, in integrative medicine. You can also kind of look at the major training programs for integrative medicine. And so one of the first one was a fellowship that started at the at the University of Arizona. And so that was started by Andrew Weil, actually. And so it probably has the most number of graduates at this point. There's another one that's probably the next biggest, which is led by the Academy of Integrative and Holistic Medicine, or AIHM. There's our fellowship at Jefferson, which is very new, and we've only graduated like 4 or 5 people at this point. But I would say maybe ask around. Maybe you may be surprised to see that some of your friends or family may know of someone. But there is also probably, and ask your care team, because increasingly this is something that's starting to show up at major health centers. And then, yeah, like Google can be very helpful too.
Thank you for that. And our last question is, if I were to, in contacting an integrative specialist, are there some questions that I should ask at our first meeting? Some key questions that would be helpful to get conversations going, to make sure this is the right professional for me?
Yeah, I think that's a good question. And I think, everyone practices a little bit differently. But I think a really important part of the first visit is understanding how willing the practitioner is going to be to listen openly. And this is maybe a bias of mine. And I'm sure there are other ways to do it, but like when I see a patient for the first time, I would say I spend like maybe 10% of the time talking. And the rest of the time, the patient is kind of telling their story, and like maybe I'm asking a few questions here and there. But I find that it's very important and that is a very important approach to kind of create a sense of like openness and curiosity and compassion. And so I think like those factors are really important in an integrative relationship. I think, the other way to kind of sort that out is maybe asking some specific questions like, how do you think about health? Like, what is your practice approach? How do you think about these different pieces? Like one of the things that can sometimes happen with integrative health, is it can become very testing heavy, which can get pretty expensive. And some practitioners use more testing than others. And so kind of understanding what the expectation with respect to testing going into it can be helpful. I think understanding like how frequently they tend to do visits can be helpful for understanding how it will fit into your life. If you have kind of specific complementary modalities that you're interested in, like acupuncture or Reiki, or Ayurveda, kind of getting a sense of if they have practitioners in the area that they collaborate with, if they do any of those practices themselves, how they think about it. I think one of the most important parts of being an integrative practitioner is being open-minded. And so sussing that out in the first encounter, or kind of in the lead into the first encounter can be helpful. So that's kind of a non-specific answer, but maybe like a general framework.
Thank you so much for answering all of the questions today. The webinar was fantastic, and thank you for broadening all of our knowledge about the importance of integrative medicine and health, for incorporating as part of your treatment plan. And if you'd like to watch this webinar again at a later time, it will be available on our website within the next few business days. However, it will be available on the webinar platform within just a few hours. On behalf of the Aplastic Anemia and MDS International Foundation, I'd like to thank you for joining us today and making us your resource of choice for information on bone marrow failure diseases. Our medical advisory board and team are always here to support you and your family, as we've done for the past 40 years. This concludes our webinar. Thank you again, Dr. Handley, for spending your afternoon with us.
Thank you. Thanks for the
Take
opportunity.
care now. Bye-bye.